Responding to an event just like this one in New Orleans can take a toll on first responders.
It certainly can. Joining us now is Dr. Glenda Demas, a licensed professional counselor and a certified public safety responder clinician, one of only 5 here in the state of Texas. Thank you so much for being with us. Let's jump right in here. You provide first responders with direct mental health support. What kind of emotional and psychological impact can attacks like the one in New Orleans have on first responders who witness the aftermath firsthand?
First responders have an extensive, significant amount of psychological and emotional distress after any type of traumatic experience. Those symptoms can include anxiety, depression, and can often lead to post-traumatic stress disorder. Any type of prolonged exposure to a traumatic experience can often lead to burnout as well as compassion fatigue as well.
And how can first responders really safeguard their mental health, when they're dealing with the trauma of such a horrific event?
When experiencing such a traumatic experience, in order to safeguard their mental health, they have to make sure that they maintain a good self-care routine. In addition, up their ability to see their psychological therapist, because that's important during this time. Make sure that you are getting routine appointments in, because anytime that there's an event of the sort, you're going to experience prolonged exposure, you're going to experience the support, and you need that. So make sure that you are seeking that support during that time.
Mm-hmm. Yeah, that self-care is so critical. What steps can they take if, let's say, they feel triggered or overwhelmed while processing the events that they've responded to?
While feeling triggered, because that's very often, make sure that you first identify what it is that you're feeling. If it's anxiety, if it's depression that you're experiencing in that moment, that gives you an opportunity to first take the necessary step. That step would be, again, removing yourself just for a little bit can often help you. In addition, I strongly, highly recommend staying in connection with your therapist. That psychological support during this time is going to truly make a difference. Also, if you're feeling triggered, allow this time for you to talk to your support group, your colleagues. Don't internalize what it is that you're feeling, because they can help you make sense of these emotions as well.
That support group could extend to even your family members, who are surrounded by you. What role do family members play supporting first responders after a traumatic event like this? And really, what are the best ways that we can help as family members?
As family members, we play a vital role in providing that support, because we're the first ones that often get to hear what it is that they're feeling. So creating a safe space for them to be vulnerable in is extremely important. In addition, exercising patience and awareness, educating yourself on what it looks like, what those traumatic symptoms look like. So that way, if you have to direct them to see their therapist, that is something that you can do, because you know and you are educated on what those symptoms look like.
Resources are so important. That's where Nami Greater Houston comes in. How does Nami Greater Houston assist those first responders who are coping with the mental health challenges that come with their work?
What we do is provide crisis intervention training to our local agencies so that they are equipped to support the staff and make sure that everyone is aware of what that looks like. In addition, our initiative through our Frontline Wellness Program provides peer-to-peer education, family support, as well as tips on how to manage stress during this time. Often first responders don't automatically think right off that it's important for them to maintain a good mental hygiene for themselves during this time, because they're just focused on providing a service to the community. But we have to make sure that they are supporting their mental health. So we do so through that initiative. And what we also do is, the month of January, we also provide a luncheon because we want to highlight all the heroes that we have throughout these local agencies that are exercising, using that crisis intervention training and providing the support to their staff. And we also want to make sure that they are consistently aware that we want this training to be long lasting, not just one time providing support, but on a consistent basis. So that way, whenever a traumatic event of the sort takes place, they know exactly what to do. So that is some of the ways that we provide the support for our first responders.
Having the support and the resources for the first responders and their families is so critical. Thank you so much, Dr. Demas with Nami Greater Houston. Appreciate it this afternoon.